Good morning, everybody. Welcome to Giving Tuesday, a day of global giving. We are so happy that you are with us today. As usual, Malawi is late. No, we don't really know what's happening there. They've received the link. They've been on WhatsApp with us, and we are expecting them at any moment. This morning, we're expecting Fred Namalima, who is a clinician who is employed by the Malawi government to serve in our impact area. And then we'll also be expecting Lexa Howard, who is one of our VIP beneficiaries. She is just one of these people who picks up everything that VIP has to offer, and her life has really significantly changed. And she is from the Khanda area where we are building. But this morning, I also have an exciting new member of the VIP staff with us. This is Jenna Mvalo. And Jenna just started working with us in, September? Yeah. So I'm going to have her say a couple of words of introduction about herself and how she became involved with VIP, and then hopefully Malawi will have joined us.
Thanks, Liz. Hi, everyone. Happy Giving Tuesday. As Liz said, I'm Jenna Mvalo. I am VIP's new Director of Development, and I'm really excited to be here. While I haven't had the opportunity to come to Khanda and to see the work that VIP is doing just yet, I'm excited to go there and see it. But I do have some experience in Malawi, and I spent a couple years living there as a Peace Corps volunteer. And then I've also been working professionally doing fundraising for various nonprofits across the US. So I'm really happy to be here, to be working with the team here. I can't wait to meet the team over in Malawi as well. And I'm really excited for today and the updates that we're going to be giving you guys.
Yeah. We just feel like this is one of those relationships that God has brought together. When we learned that Jenna had lived in Malawi for a couple of years in the villages, it was just really amazing. She's married to a Malawian. She has 2 children. So we're just so excited that God has brought her to VIP. So we just want to say that we are so excited that all of you are with us. We see Vincent Chilombe is with us from Malawi. Good morning, Vincent, or good evening over there. I think it's like 5 p.m. over there. And we're hoping that everything is well. We know that Malawi is really having some struggles right now. They're facing Forex shortages, and that leads to shortages in everything else, especially fuel. And there's a lack of diesel, there's a lack of petrol in the country. I know last week when we were practicing with our staff, they lost electricity, and then they got onto a generator, and they had they were running out of petrol. So we face those kind of challenges all the time when we're trying to connect with Malawi. We wanted to open up today with a video of about the Khanda Clinic and the building of the Khanda Clinic. We see that we have on the call with us Macy Carmen Goki. And Macy is the actual original architect for the Khanda Clinic. And she and the district health office from Zomba, Malawi, went back and forth on the design, and she kept revising it, and then it went to an architect in Malawi. And so we're just so excited that Macy is with us this morning. And now we're going to open up showing you the video of Khanda and why it is so needed.
Miendo inauma makwawa mukanyone nakuti ndinachira pakomo Makwawa mwana kubadira kasiku. Zinazo chitisa manyazi chifukwa banali anyamata tiwana tatimono kumaonelea zimene.
Ngoja pada kuja naba samunena kuti ndinabadisa mwana pakomo wa moyo koma mwana nabadasa movuta chifukwa kuti sana alile.
For years, a medical team from America has paired up with a medical team from Malawi to offer outreach clinics in remote areas of Malawi where there is no access to health care.
Khanda is close to Lake Chirwa, which is a basin which collects water and has no inlet and outlet. So it's a swampy area. People have a lot of bites from mosquitoes. Whenever they have malaria, it has been difficult for them to travel Khanda, resulting into the malaria conversions, which has created a number of cerebral palsies and brain damage to most of the children who are under 5.
According to government recommendations, we're supposed to have a health center per 10,000 population. So you can actually see that's way beyond the recommended threshold, because there's more than 30,000 people that reside in that area.
One year, when the medical team was wrapping up, the group village headman, Chief Khanda himself, came to Lucy, who is the chair of our health committee, and said to her, "What you are doing is very powerful, but when you leave, we still have children dying. We still have women giving birth on the side of the road." And so he asked Lucy and the medical team to consider offering something more permanent. And that's when we started building a health center for Khanda.
So Malawi has the people, they have the knowledge, they have these tremendous practitioners, they have these tremendous nurses and pharmacists. What Malawi doesn't have is the ability to build infrastructure. We need to finish construction, we need to bring electricity there. It's also very expensive and very labor intensive because again, there's no machinery, it's all done by hand. It also needs to be furnished, this is a big facility. We also have to build clinician houses for 2 clinicians that will live out there because it's too far to come back and forth every day, and 3 nurses' houses.
Designing for health and wellness and sustainability here in Malawi is not a luxury or a privilege, it's a necessity. The Khanda Clinic has 2 main portions, the outpatient department and the maternity ward. Each one has its own courtyard, making the building sort of a figure 8 with shared spaces in the middle. Pregnancy and maternal health is a very private thing in Malawi. So giving them their own separate wing allows those mothers and women to have privacy in those medical decisions.
It feels really exciting. It makes me start to cry when I go over and see this clinic because we promised hundreds of people that we were going to be building a medical clinic on this site, and they were thrilled. And it warms my heart that now we're really going to open up this wonderful center.
Ndipotaluza mioyo yangu ichuluka chifukwa chikanabwera matenda akolera pambiri pazikulosera pansi kuno kwa Khanda.
During this season of giving, we invite you to open the doors of the Khanda Clinic. Join us in providing health care. All right, I see Malawi has joined us. Can you hear us?
Yes.
Okay, great. Today we have Fred Namalima and Amai Lexa Howard and Violet Matamati from our staff. And who's behind there? Is that Joe? Joe Matamati and Ernest Makoka. So happy you're all with us. What was happening there that caused a delay? Was it electricity or what was going on?
It was an issue to do with electricity. So now it's sorted out. We are online now.
Okay. So happy to see you.
Thank you. Happy to see you too. Thank you.
Yeah, thank you. Before we begin the interview, we just wanted to take a moment and talk about our goal for today. We have a very big goal that we believe we can reach through all of our VIP family. Jenny, you want to tell us about that?
That's right, Liz. So through the work of our generous donors, we have a $50,000 match today. So that means that for every dollar, every $5, every $20, every $100, up to $50,000 that's given today, that will be matched. That will all go to help open the doors to the Khanda Clinic to help our brothers and sisters in Malawi. So really grateful for that.
Yeah, that gift is so powerful and just as an inspiration to others, because everyone knows that their dollar. So one of the things I just want to start out with showing everybody exactly where Khanda is. So can you help me? I just tried pushing the button to the and now we're focusing on Malawi. You can see Lake Malawi. And now we're going to even focus in on our VIP office. That is in the city of Zomba. And then we're going to move over to impact area, 29 villages. We just added 3 more villages in 2021. So that shows now where the content in relationship to our I want to now show where the other okay, this is where the other to the Khanda Health, where the Khanda Health Center is currently being built. So that when Malawi begins to talk with us about the challenges that they have, people can understand how far the centers are. So, Amai, we understand for people to walk
Look at this very speed and reception.
it is such a challenge. Can you tell us a little bit about that? How do people get to those other clinics? How do people manage to get health care?
Good afternoon, madam.
Good afternoon. How are you?
I'm fine, and how are you?
Yeah, I'm fine too.
Thank you.
My Alexa, maybe you could start out by telling us a little bit about how you've been involved with VIP.
In a VIP, ndimagwira ntchito ngati promoter, health promoter, komanso ndi zambiri zimene ndikuchita mkati mwa project osiyanasiyana amene a VIP akuchita.
Her name is Alexa Howard. She is involved with the VIP in so many sectors, but mostly she is a health promoter.
And when
nawo za Nkhokwe, ndinawo mu menero la Nkhokwe kwa Khanda, ndine treasurer wa Nkhokwe. Komanso ndine mmodzi amene ndaphunzitsidwa zambiri ngati kapangidwe manyowa.
Yeah, as she has said, she is involved with the VIP in so many interventions. She is also a treasurer in the Grain Bank, and also she has benefited by learning how to make a compost manure. So she said that she has benefited a lot with the VIP.
Komanso ndine ngati promoter, komanso ndine mugulu la masheya monga amene timalipikisidwa za VSL kuchokera makeya group amene tili.
She is also a member of VSL, Village Savings and Loan, those that has been established by Villages in Partnership.
Okay. It sounds like you are a person who just picks up every tool that VIP is offering.
Hello, Amai. We can't see, we can't hear you correctly. The reception is very poor.
Oh, I'm sorry about that.
Yeah, so it's just like cards. You just, yeah, we can't hear you correctly. I don't know if you are hearing us correctly.
You are coming across fine.
Yeah, I think it's kind of like maybe the microphone on your side. I don't know if.
I'm using the microphone that I always use, so I don't think that might be the problem.
You're kind of like breaking up.
Okay. Maybe my Alexa. Well, let's go over to Fred Namalima. Fred, can you introduce yourself and tell us a little bit about your work with VIP?
Sorry, I didn't even hear a word.
Okay.
You're just breaking up.
Yeah. Maybe you can open your WhatsApp and we'll communicate. We'll try both. Oh, I know it's on their end. It's not us.
Yeah. I thought one of the things that was really interesting that Lexa was sharing was about how she's participated in a lot of the different projects that VIP offers.
Yeah, that's when we really see people's lives being changed, is whenever they pick up. We've seen a pattern now that whenever they pick up 3 or more tools that VIP is using, their lives really dramatically change. And our mission is that we move people from level 1, extreme poverty, to level 2, a sustainable lifestyle. And so where a person like Lexa Howard is really, we see that when we go visit her. Her house is beautiful. She has food security. She's able to feed her family the whole year round. That really makes a big difference.
And on top of taking advantage of the different programs VIP is offering, she's also contributing to the community by being a health promoter.
Yeah.
And I know we couldn't hear very much about that, but it sounds like that work is not just benefiting herself, but it's benefiting all of the people that can't access the clinics and that can't get the medical treatment.
Yes. And it also is, health promoters are working on preventative measures. They are going out into their communities and meeting with groups of people, particularly women, and discussing issues on health and nutrition, maternity, health issues, family planning, HIV/AIDS prevention, all of these things that will help to educate people in the communities.
And it looks like on the map that you were showing us before, the Khanda area is actually quite larger than some of the other villages and the areas around there.
Khanda is by far the largest village where we are working. Yes, it has the most households in it. But the health center will not only be servicing the village of Khanda, it will be servicing the whole region. And so we're really so grateful for all of you who have been contributing to that. We started raising funds to build the Khanda Clinic in 2019. And so we are so excited that we are finally being able to build the clinic and are very close to opening the doors.
That's great.
We still have a couple of big hurdles that we are raising funds for to open the doors. The interior is nearly finished, but we have to furnish the whole clinic, and then we have to provide electricity. It will take a couple of years for the government to bring us electricity. And so, and because we want to get the doors opened and have stable electricity, we are right now sizing and costing solar for the clinic.
Wow. It looks like our friends in Malawi are back on, so let's see if we can hear each other.
Okay. Okay. Can you hear us? Hello?
That's better. That's better.
Okay, great. Mr. Namalima, we didn't get to introduce you yet.
Yeah.
Could you introduce yourself and tell us a little bit of how you are connected with VIP?
Well, my name is Fred Namalima. I am a medic from Malawi. Professionally, I am a clinician. In Malawi, we have the position of clinic officer. A clinic officer in Malawi is the one who does some of the minor surgeries and is like next to the doctors in Malawi. How I get connected to VIP? I've been working in the catchment area where the Villages Partnership is working. So I was there when VIP was developing, and I have been involved in the planning of the clinics, the outreach clinics, and moreover, I was also sponsored with the VIP to upgrade my papers. Sure.
Yeah, and that has benefited so many people. We are so grateful for your partnership, Mr. Namalima.
You're welcome.
Yeah. So to be clear, Mr. Namalima is not an employee of VIP. He works for the Ministry of Health, the government of Malawi, but his partnership has been critical for VIP to be able to provide health services in our impact area.
Sure.
Yeah.
We'd like to ask another question for Amai Lexa, if she can hear us now. Can you explain some of the health issues people in the community face?
Mavuto ndi ambiri amene anthu akumudzi amakumana nawo kapena ngati anthu amene azungulira dera la Khanda akukumana nawo. Vuto loyamba ndi vuto la chipatala. Vuto lachiwiri ndi vuto la kusowa kwa madzi aukulu. Palinso vuto lina lachitatu limene ndingaongezerepo ngati vuto la kusowa kwa chakudya.
Yeah, people in Khanda face a lot of challenges concerning to health. And the biggest one is the problem of having no clinic. And the second one is water problem, clean water problem. And the third one is about food security, food shortage.
Pavuto loyamba lomwe ndafotokoza vuto la chipatala, vutoli lakhala lilipo ndipo linalipo kuchokera mbuyo kufika lero.
For the issue of clinic, we have been in that problem for a long time. We have been lacking clinic since then. When I was born up to now, we are still having that problem in our village.
Vutoli ndiloti lasausa kwambiri anthu adera limeneli la Khanda kapena onse amene ozungulira derali. Chifukwa zipatala zimene tikugwiritsa ntchito panopa ndizotalikira kwambiri potengera ndife anthu akumudzi ndipo takhala tikuluza miyoyo ya anthu ochuluka chifukwa cha vuto limeneli la kusowa kwa chipatala.
This challenge has been like something that disturbs or maybe put in our minds, like we think of it every day and night as a problem, as a challenge, because it's not only for our the village of Khanda only, but even all those villages that are around Khanda, we do face that challenge of having no clinic. So it has been a long time for us since we started experiencing this problem.
So the people of Khanda don't have access to a clinic, but also the people in the villages around that area too can't get the care that they need.
Kunena zona anthu akwakhanda kapena onse amene azungulira derali amatha kupeza thandizo koma movutikira monga mmene ndanenera kuti zipatala zimene tikugwiritsa ntchito panopa zikutali kwambiri.
People of Khanda, they do have access to health services, but those health services, they get it from far clinics. So they just need to travel from their villages to the clinics, which is too far from there.
So some people have to travel really far if they want to get treatment. What are some problems that happen when people have to travel so very far to get medical help?
Ndi mavuto ambiri monga mmene ndafotokozera kale ngati vuto loyamba ndikuti timatha kuluza moyo wa munthu chifukwa ena amatha kumwalira mwina nthawi yawo yokuti amwalire isanakwane koma chifukwa cha vuto la kutalikira kwa chipatala kuti akanathandizidwa mwachangu kumapezeka kuti munthu wamwalira pamene nthawi yake yokuti amwalire isanakwane.
The biggest problem, the biggest thing that they face is that when they are trying themselves to access those health services in those far clinics, sometimes it happens that people do die on their way to the clinic because of long distances. So maybe that patient wasn't his or her own time for them to die, but they died because of long distance traveling.
kumbali ngati ya azimayi oyembekezera ena amatha kuchirira ndithu kunjira pa nthawi imene yakupita kuchipata monga amene mazula matenda amene achizimayi kuti munthu akafuna kubereka zilibe nthawi yeniyeni.
For pregnant women, they do deliver on their way to the clinic. So that's not respective in our country and also to the health of the baby. So that's also the challenge then that they face.
Komanso ngati azimayiwo amathanso pena kuuza moyo yawo monga amene ndanenera kale kuti ulendowo ndi wautali.
And those pregnant women, if they are not well managed and they like receive the treatment, they also die because of delivery. If they have some other issues like complications during delivery.
So people can die because it takes too long to get the care that they need, and then that's another issue for pregnant women that they can't make it to the hospital to have the babies, and that's dangerous for the mothers and the babies.
Mr. Namalima, when we go and serve in some of these remote clinics, when the American team is on the ground, these are some of the crowds that I know you have found waiting for you when you go to serve. Can you describe to us some of the diseases and medical challenges that you see? I know sometimes you've told me, like, because people live so remote, they wait too long to receive care, and then a problem has really escalated. Can you tell us a little bit about some of these challenges?
Thank you. In Malawi, healthcare is still a problem. As you know, Malawi is one of the developing countries. We are still developing, and we are still developing even in healthcare services. Really, the picture in the view is a mass of people waiting whenever we have the outreach clinics with the villages in partnership. A lot of people have been waiting because of the common diseases that affect the lives of people. In Malawi, we have malaria, we have diarrhea, we also have the pneumonia, the scabies, the dysentery, we have got the musculoskeletal pains, the higher BP, the non-communicable diseases, and in around Khanda area specifically, we have cases. We have been having cases of cholera because Khanda clinic is very far, as my colleague said, and geographically is located near to the lake, Lake Chirwa. Lake Chirwa is a basin, has no outlet, meaning that water and sanitation issues is a problem. And most of the catchment area around Khanda is a lowland area where swampy grounds where mosquitoes develop, and issues of water and health and sanitation is a problem. So most people have diarrhea, scabies, malaria because of the geographical feature I have explained.
Mm-hmm. Yeah, I, you know, in the United States, we don't have malaria. And that was wiped out many, many years ago. And so we know that the people are still suffering from diseases that are preventable. Can you tell us in the remote communities, what's maybe the most common cause of death among children? Sometimes when I'm driving through the communities and I pass a graveyard, I see very small grave grave sites for children. Tell us what is the most common cause of death among children?
The most common death among children, among under 5 in Malawi, is we have diarrhea, malaria, we have pneumonia. Yes, these are the 3 common diseases that cause death among children.
So I'd like to hear from you as a clinician, and then Amai Howard, how will the opening of the doors of the Khanda Clinic, how will that help those remote communities? Looks like they froze. This is a problem we deal with all the time when we're talking with Malawi, that they lose their internet connection, and so it looks like they might have frozen. Hopefully they'll be back with us. We just want to note again that we have a $50,000 matching gift. We hope by the end of the day, we will have met that. And in one day, we will have raised $100,000. I woke up this morning and Aaron told me we were already at $13,000. So we're really grateful for all the gifts and contributions that are coming in.
And we just got an update. We're actually at 16,038 right now.
That's awesome.
That's
just
great.
In an hour, we have increased $3,000. So thank you, everybody. We are so grateful for your generosity. Does anybody online have any questions or comments that you would like for us to ask either Fred or Amai Lexa Howard? I also have some pictures that I can share with people. Aaron, you want to move on in the slideshow? Oh, okay, let me try. Okay. This just shows, this is a picture of Malawian and American clinicians. Whenever the American medical team goes over, we always have a collaborative partnership with Malawians, with Malawian health clinicians, data clerks, people taking malaria testing and HIV testing. Our medical team is never alone. And part of the advantage of that is that they are seeing things in Malawi that our American clinicians and medics don't see over here. And so we absolutely need their collaborative work with us to help them figure out what medications to use, doses, things like that. So our team has learned a lot from our Malawian clinicians. Not only are we offering, when we do these outreach clinics, not only do we offer typical healthcare, but we also offer dental care and eye care as well. And both of these, dental and eye, will both be provided in the upcoming Khanda Clinic. So we see that our Malawian partners are back online with us, so we're going to ask them to join us once again. All right. Yes, good to have you back. So I don't know if you, did you hear my last question, Fred?
Yes.
Okay.
I can continue from where I stopped.
Thank you.
Most of the problems are the coming in of Khanda Clinic will solve most of the problems people have been facing, like the complication of labor and delivery. You see, it is very good when a pregnant mother starts antenatal care and is monitored to avoid complications during delivery. So with the coming in of Khanda, it means the women will be seen right there. it's like the clinic is near to them. So most of the women will start their antenatal clinic very early. That's within a period of 3 months when they become pregnant, which is the national standard in maternal and neonatal health care. Again, on the second one, it means most of the women will stop delivering on their way, and they will be attended to at the clinic with the medical team, with the nurses and clinician. And most of the complications which have been there, the complications like maybe retained products of conception, bleeding, will be minimized because they will be attended by a skilled professional. And moreover, the transportation, people have been using an ox cart to carry a pregnant woman to very far health site for delivery, and in case they deliver on their way, it has not been heard. So we have the good health in terms of the little children, the newborn babies, and also their mothers. And emphasis on prevention of diseases will be achieved also, because the coming in of the clinic, there will be immunization, health education, the home visits, and the LLA health seeking behavior will be achieved because the clinic is at their disposal. So the coming in of Khanda clinic will improve the health system in Malawi, particularly in the catchment area of Khanda, where health issue has been a problem.
It's so hard for us to even imagine a woman in labor on the back of an ox cart going to the clinic. We can't even imagine that.
That has been the mode of transport, the only reliable mode of transport in Malawi. And maybe some people who have been maybe injured, maybe they have had an accident. There are some situations whereby they have been wheelbarred to the clinic. So you just imagine wheelbarring somebody from a distance of over 35 kilometers. The outcomes thereof is not always good because of difficulties in breathing. Somebody is already injured. Most of the time they get to the hospital already dead. So
did you say that some people are transported by a wheelbarrow?
Yes.
Wow.
Wheelbarrow, a bicycle, a pushing bike, and ox cart has been the mode of transport in the community, and it's like the standard one.
Yeah, thank you for giving us that picture. That really helps us understand the challenges.
And maybe before Lex comes in, the last one is the coming in of the clinic also will improve referral system, because people have been moving a long distance to get the medical help, and now the clinic is right there at Khanda within their disposal. It means the health professionals who will be deployed at that site now will improve the referral system, because they can call for an ambulance within a short period of time. The patient is picked to the referral site and get help after the first aid has been given.
Wow. Yeah. Okay, thank you. My Lexa, did you have a comment?
Kunena zona chipatalachi kumbali ya ife anthu akwa Khanda chitithandiza ndithu, ndipo mavuto athu ambiri akubuka chifoti ambiri amathamwina ena kukuta ngongole m'makomo ngati mzimayi akakawembekezera ndi kuti umayenera kuti usunge transport kuti nthawi imene matenda ayamba pezeke kuti uzayende mwachangu kuti ukafike kuchipatala. Ndiye pa nkhani imene chipatala chabwera kwa Khanda chikasekulidwa ndi kuti vuto ngati limeneli lichepa chifukwa kunena zoona tazunzika ndipo tikuzunzika.
Yeah, to say honestly about the opening of Khanda, it will minimize the burden that the people from Khanda were getting. For example, when a woman is pregnant, they start getting loans from other people so that they can save that money, like getting that loan and save it to prepare for labor when it starts for that woman. So it's just like they just indulge themselves in loans, unexpected loans that they may sometimes they don't think of how to pay them back, but because they've got a challenge, they just need to do that.
I just want to explain that to anybody on who's listening, that the government, to encourage women to deliver at a clinic and not to have home births, they instituted a fine if women would not deliver at a clinic. And so that's what Amai Lexa Howard is talking about, that is sometimes if a woman can't make it to the clinic, they end up being fined by the government, and then that creates an even bigger burden for them. So thank you for sharing that with us. We have a question that's come in from the audience.
Yeah, can you tell us about some of the programs you have post-maternity for new mothers and baby?
Okay, we have the immunization schedules. When a child is born, education is made to the mother on the importance of immunization, and the importance of keeping the timing for immunization so that the child can grow healthy. And the other one, the first thing is, of course, education on breastfeeding, exclusive breastfeeding.
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 Uh-huh.
And in Malawi, most mothers cannot manage to not breastfeed, or cannot manage to buy formulas for their kids. So the government of Malawi adopted the exclusive breastfeeding to avoid malnutrition to children, the newborn babies. So the mothers are encouraged to breastfeed, exclusively breastfeed up to 6 months. Then thereafter starts complementary feeding and continue with the other feeding formulas. The other thing is on hygiene, hygiene of the mother and babies. They are also educated on how to take care of the child, what they are supposed to do. They are taught on the danger signs of diseases. When a mother in Malawi also delivers at the hospital, they are given a mosquito net. Actually, they get 2 mosquito nets. The other mosquito net is given during antenatal, during pregnant. And soon after delivery, they are also given another mosquito net for the baby now. The other one was for her to be protected during pregnant. Now this one at delivery is for the baby so that they can also be protected from malaria. And maybe the other one on the mothers, they are also taught to have a family planning method so that they can take care of this child and raise them, and so that they can have good health in order to have the child spacing. You know, without following the family planning methods, a sequential childbirth can cause complications like malnutrition and under 5 days.
Uh-huh.
Yeah.
Okay. All right. Well, we're running out of time right now. For those of you who are with us and watching, please share with your friends and family that At 12 noon, we have another 12 noon Eastern time. We have another gathering with our Malawi staff via Zoom. You have to sign up for the Zoom link. And then in the evening, we'll have words from Lucy Goki on her experience with the healthcare in Malawi. We know that Fred and Vi and Amai Howard, we know that it's nighttime there, that it's dark, and yet you have come all the way to the VIP office and to make this time to meet with us and help us understand how important the opening of those doors are to the Khanda Health Center. And so we're very, very grateful for you being with us today. Thank you so much.
Thank you.
Thank you so much. And thank you everybody for joining us today. Thank you so much for supporting our friends in Malawi and for helping us to open the doors. We look forward on keeping you updated. We still have a long way to go on Giving Tuesday to reach our $50,000 matching gift goal. Thank you.
All right. Bye. God bless you.
God bless you too.
Thank you.
Come on.